Hello, and I am Dr. Corey King, and thank you for watching my video. I put out a ton of content each day and each week with videos and webinars and blogs because my passion is helping patients who are struggling with chronic health conditions. And I find that the more information that I can provide, the more value that I can give to other patients. And besides contacting myself to work with me, they can also find other doctors that can help them with the ideas and the education that I'm giving to them. So you can find more information on AskDrKing.com. You can look at our fan page on Facebook, Ask Dr. King, to find more information. So for today, what we're going to be discussing is infections. And infections are one of the most common triggers for chronic health conditions, especially autoimmune conditions. And I'm going to share a little story with you. 2 years ago, my fiance Natasha and I were living in Laguna Beach, California, a beautiful location to live, but we started getting sick. And I was racing mountain bikes at the time, and I was winning my races, which is great the first half of the season. The second half of the season, I just wasn't performing how I was used to. I wasn't recovering properly. I wasn't winning. I was finishing second those races, but I just couldn't recover. And Natasha was having chronic migraine headaches, which is not normal for her. So I started getting a little suspicious. So I called a company out to our home and I had them cut into some drywall, and sure enough, we had mold. Not just mold, but we had toxic black mold. We moved out in 2 days. Unfortunately, we lost 2 of our dogs due to the mold, but that's another story. So fast forward 2 years after the mold, or we realized we had mold, we are still detoxing the mold out of our bodies. Now, what happened to Natasha was the toxic black mold triggered Epstein-Barr virus to turn on in her. And EBV, I've worked with a ton of professional athletes over the years with EBV, and normally patients get over it in about 2 to 3 months. So I wasn't really concerned. I was just thinking, okay, she got sick, got run down with work, and she has Epstein. So we got her over that. It took about 3 months for her to get over the Epstein-Barr virus. But then a year later, it came back, which is not normal. At the time, we moved from California to Austin, Texas, and that's where we're currently at. And I started running some laboratory tests, and sure enough, the Epstein-Barr virus had come back, but she now had Hashimoto's disease. Hashimoto's disease is an autoimmune condition of the thyroid, and it runs in her family. So for almost 7 years, we would do blood work on her and make sure she didn't have an autoimmune condition, and she was doing fine. Then the mold, the virus, and the Hashimoto's. So we know that the mold is a fungi, it's a toxin, it's an infection essentially, and then it triggered a virus to turn on Natasha, which then triggered her autoimmune condition to turn on. So the reason I want to bring up infections is because a lot of autoimmune patients, and even just patients who are struggling with their health conditions, they contact me and they say, hey, Dr. King, I'm doing X, Y, and Z. I've been having this symptom or this condition for so many years, but I'm just not getting better. I always start to think about infections. So besides a mold infection, which is environmental, that's a toxin, you can also have bacterial infections, you can have parasitic infections, you can have viral infections. In a normal white blood cell, which is what most doctors should run on patients, they're going to see if there is a bacterial, viral, or a parasitic infection. Now, sometimes those blood tests aren't 100% accurate because if the immune system is weakened to the point that it can't even tell us that there's something going on, you're not going to find those results in a basic blood test. On top of that, we had to do, it was almost $800 test for mold. Our insurance didn't cover it. It's a bummer. Yes, I know, but we've got to get over that because insurance is not going to cover specialized in-depth testing. So we did a special mold test to figure out what type of toxins were in Natasha's body. You can also do things like specialized stool test. The specialized stool tests that we typically run take about 2 to 3 weeks to get those results back. So it's not just your normal stool test that your doctor runs and in 2 or 3 days you've got the answers. There's also a lab called cyrexlabs.com. They have a fantastic test, or what they call an array, and it's called array number 12 if you go on their website, and it tests all these other different infections, from viral infections to bacterial infections to certain STDs. If those infections are there, your body is never going to recover properly without getting rid of the infection. Once you can find out what type of infection you have, then you can start to go after it. And you can start to kill it if it's a parasitic infection, a bacterial infection. You can start to support the immune system to help fight off viral infections as well. Maybe there are some mycotoxins like mold toxins or spores inside the body. You can then start to pull that junk out of your system. So I really want to get across kind of the take-home message today. If you have an autoimmune condition, get checked for an infection. Hidden infections. If your doctor's not run the basic blood test or they're not concerned, find another doctor or contact myself, AskDrKing.com. The other thing, specialized testing. You won't always find these answers in the basic blood test. So if you're having fatigue, stamina issues, if you're not sleeping well, if you're having GI issues, maybe some fertility issues, you want to dig deeper. Another big infection that is talked about a lot lately, Lyme's disease. And there's only one lab in the country that's great at testing Lyme's markers. So you've got to make sure that your doctors, they're knowledgeable on the specialized test. They're knowledgeable on how to kill off the infections if you do have them. If you have a hard time finding a doctor, that's okay. There's a ton of them out there, but they're not your traditional Western medical doctors, I can assure you. There's some good Western doctors out there that are more integrative, which we're actually seeing one right now for Natasha, but we're combining some of his protocols with some of my protocols, along with some other doctors' protocols. So a lot of times, it takes a lot of time and research to figure out exactly what's going on, and then you can start to piece all the pieces to the puzzle together. So again, infections. If you're struggling with a health condition, if you're having GI symptoms, if you're having fatigue issues, find somebody to start looking for infections. Again, you can find more information on AskDrKing.com. You can find our Facebook page, AskDrKing. Even feel free to shoot me an email, drking@askdrking.com. And I thank you for watching the video. I hope that you learned something of value from this. If you did, like it, share it so we can help more people out there overcome these chronic health conditions. Have a great day.